Today, our group is going to present about case study 1 regarding immunodeficiency.
Question 1. What is PJP? PJP is an infection of the lung caused by the fungus Pneumocystis jirovecii. PJP is a common condition in people that have a medical condition that weakens their immune system like HIV or AIDS, or take medicine that lower the body's ability to fight germs and sickness.
Number 2. What is the significance of the purplish spots over Katie's neck and arms? Kaposi sarcoma. Katie had developed Kaposi sarcoma, which is a cancer that usually develops from cells that line lymph or blood vessels. In Katie's case, these affected areas are called lesions. Although it may not show symptoms, the development of KS can also be an indicator that HIV has become AIDS. Treatment available for KS includes applications of medicine on the skin, cryotherapy to freeze the cells off, or surgery.
Question 3. Differentiate between HIV positive and AIDS.
The differentiation between HIV positive status and AIDS. HIV stands for human immunodeficiency virus, which belongs to a group of viruses called retrovirus, while AIDS stands for acquired immune deficiency syndrome. A person who has HIV can develop into AIDS if untreated. Meanwhile, a person with AIDS cannot develop into HIV. Besides, a person who has HIV may have an active and effective immune system, as it has no symptom, while for AIDS, the immune system is severely damaged and unable to fight off infections. HIV attacks and destroys the T cell and CD4 cell. Meanwhile, AIDS is the final stage of HIV infection.
Question 4. Why is KD development of KS and PJP of particular importance in light of his HIV status? Okay, so here we can see that in a HIV patient, their CD4 cells are being attacked and damaged by the viruses. So how can KD develop Kaposi sarcoma in PJP in light of his HIV status? It is because of low CD4 plus cells level, which is usually below than 200 microliter. As a study has shown that decrease in CD4 cells has associated with the increased risk of Kaposi sarcoma, where the viruses attack their CD4 cells, causing them to damage and drop in numbers. Next is due to immunologic deterioration of the host, where their cellular and humoral immunity are defective, causing them to susceptible towards infections, and commonly with Pneumocystis jirovecii pneumonia or PJP, that cause the respiratory disorder in these HIV patients, especially in those without prophylaxis.
Number 5. Factors that might have influenced KD's development of PJP and KS could be due to discontinue the treatment of antiretroviral therapy, or it is known as ART. ART is basically not effectively cure the disease, but somehow can control the disease. This is because it consists of combination antiretroviral ARV drug that suppress HIV virus and stop progression of the disease. It will reduce the amount of HIV in blood, that is called viral load, and also increase cell count of CD4. Therefore, stop this medication could provide the chances for HIV to multiply rapidly and reduce the level of CD4+, thus weaken the immune system. Decrease in CD4 level associated with risk of KS and also PJP. Huge reduction have been seen in rates of death and infection when ARV regimen is used, particularly in early stage of disease.
Question 6. Identify 4 problems that should be managed regarding KD.
Problems that we have to manage. First is treatment for Pneumocystis jirovecii pneumonia. Next, the lack of nutrition due to the skipping meal. Also, to reduce the fever and regulate the breathing problems being experienced by KD.
Question 7.
Precaution that health workers need to use when caring for KD is routinely use appropriate barrier that can prevent skin and mucous membrane in contact with KD's blood. This is because HIV can be transmitted through direct contact of bodily fluid between HIV patient and normal people. Next, gloves should be worn when handle anything related to blood and body fluid of KD. Next, health workers should wash hand and other skin surfaces immediately when contaminated with blood and bodily fluid. All healthcare should take precaution to prevent any injuries caused by needles or other sharp instruments during procedure.
What is the focus of your ongoing assessment? HIV or AIDS monitoring is essential in guiding when to recommend initiations of therapy. Clinical monitoring will include staging of the HIV or AIDS disease using either the presence or absence of HIV-related signs and symptoms, according to the WHO staging systems. Various laboratory methods can be used to monitor the disease progressions and to guide whether the patient will need antiretroviral therapy or not. The assessment also enables the clinician to make decisions on the treatment and to give information on prognosis of the patient.
Question 9. Major side effects of KD's antibiotic that should be monitored. Okay, so the antibiotic that had been administered to KD was trimethoprim sulfamethoxazole or Bactrim. The side effects of this antibiotic is nephritis, which is the inflammation of the nephron, which is the functional unit of kidney. Next is hyperkalemia, which is the elevated level of potassium in blood. Next is skin reaction, which can occur from mild rash to anaphylaxis. The following is nausea and vomiting, followed by bone marrow separation. Next one is drug fever that usually occur due to the administration of certain drug, which can disappear by the discontinuation of that particular drug. Next one is diarrhea, and last but not least is pancreatitis, which is the inflammation of the pancreas. Question 10. Aspects of KD's care that can be delegated to LPN.
Administering first dose of IV trimethoprim sulfamethoxazole Bactrim, monitoring KD's pulse oximeter readings, reporting under values of 95%, and repositioning KD's and having him deep breathe every 2 hours. Administering first dose of Bactrim is good because Bactrim is a drug that combines the action of sulfonamide antibacterial and dihydrofolic reductase inhibitor antibacterial. Is used to treat bacterial infections, in our case BJP. Next, monitoring KD's pulse oximeter readings. Pulse oximeter reading is a non-invasive and painless test that measures the oxygen saturation level and oxygen level in the blood. It detects the changes of oxygen being carried along the bloodstream to the whole body. Also, repositioning KD and having him deep breath every 2 hours. This will help breathing, clear the lung, and lower the risk of pneumonia. Also, changing the position assists in making the breathing and coughing exercise work better.
The progress of the case study is as stated. Question 11.
KD is capped on Bactrim 2 tablets once daily. He asks why he has to keep taking the drugs. Since the pneumonia is gone, how would you respond? So the drugs is prescribed to him, as this is known as the most recommended first-line treatment in treating the BJP. This treatment is very important as the infection is known to be almost always fatal. The response to treatment in patients infected with HIV may take longer than usual but should occur within the first 8 days. However, the length of treatment should be 21 days in HIV-infected patients and can increase if there are a larger burden of organism that might slower response to the therapy. Hence, KD has to keep taking the drugs at least for 21 days to avoid reinfection.
Question 12. 4 additional topics that should be discussed with KD before he goes home. First, avoid excessive alcohol or drug use, as alcohol can damage the liver, which the body uses to process anti-HIV drugs. In addition, heavy drinking and taking recreational drugs can also weaken the immune system and making it harder for the body to recover from infections. Next, managing stress and getting support. Moreover, do not overwork and taking a rest when necessary. Most important, commit to antiretroviral therapy by taking medicines as prescribed.
Question 13. Laboratory data that will most likely to be monitored in KD in future.
The laboratory data that will be monitored are complete blood count, CD4 T-cell count, and HIV viral load test. CBC checks the level of the white blood cells, red blood cells, and platelets. People with symptoms should perform a CBC test every 3 to 6 months. Besides, CD4 T-cell count is done to keep track of the immune system. HIV will attack the CD4 cells and make small copies of itself. Over time, there will be decline in number of these cells. In HIV-negative people, the normal CD4 cell counts are around 500 to 1,500 per millimeter of blood. Moreover, HIV viral load tests measure the amount of HIV in a drop of blood. This test is important to monitor the HIV disease and how well the therapy is working. When the HIV level decreases or stable, the potent HIV treatment is working. When the level is increased, it means that the regimen has stopped working.
Question 14. Opportunistic infections that KD is at risk for developing.
Opportunistic infection that KD might risk for develop is candidiasis. Candidiasis is an infection caused by fungus candida and causes severe or persistent infection in mouth or vagina. Next is histoplasmosis that often develop in lung and spread to other parts. Lymphoma refer to cancer of lymph nodes and other lymphoid tissue. Next is cryptococcosis that is caused by infection of fungus that typically enter the body through the lung and cause pneumonia. The other opportunistic infection is herpes simplex virus (HSV) that inactive in most people but can reactivate the virus in HIV patient. Progressive multifocal leukoencephalopathy is a rare brain and spinal cord disease that's seen almost in people with weak immune system.
Thank you for your time. Thank you for listening. With that, we thank you.